guys, welcome to my fashion clinic and civil health tips. So the last time we were talking about how your poo can speak, and I said we'll continue from how this topic is useful to mothers. And for that reason, we'll be talking about children poo. So today we'll be starting from black poo. We are starting from black poo because every newborn starts with black sticky poo that looks like tar. And I can imagine your face when you saw that poo. This is called meconium. This is very normal because this is the baby clearing out their system of everything they swallowed in the womb. So you should expect this within 24 to 48 hours after childbirth. Or if this doesn't happen, then you should contact the doctor because sometimes baby pass this meconium while they are in the womb, and this may be as a result of what? Stress, anxiety, This is very dangerous to the child health when he healed. So if this happened inside the womb, the doctor will know because they will conduct some tests. This will result in extra care of the baby. That is why you have to go to a very good hospital when you are pregnant. Next is yellow CD poop. This usually happen among breastfed babies. If you are breastfeeding, you start to observe or start to see this bright yellow poop that has little seeds in them. So it is normal. This means that digestion is going well. So as the baby is healthy and their weight is okay. Also, one thing I want to point out about breastfed babies is that they don't usually poo all the time. That means they poo less. Sometimes they can poo every day, while sometimes they can poo today and then next tomorrow, and then in the next 3 days, then in the next 2 days. There was a time my mom was telling us a story about her first child. She said there was time she would check the diaper like 100 times. What is going on? Is my baby not going to poo? What? So until people that already have that experience told her that it is normal. So it is normal. It's not because your baby is not fine. It is normal. It's because breast milk is very well digested. So at the end, it leaves like little or no waste behind. The breast milk just going to the system of the baby. We all know that the poo we poo is as a result of undigested food in our system. So if there's no undigested food in our system, there will be no poo. So it's because breast milk is very well digested, very healthy. That is why it is very important for you to breastfeed your baby. They also poo 2 to 5 times a day in the first weeks of breastfeeding. Now let's talk about brown poo. This is usually among formula fed babies. They usually have this thicker poo and what's brown poo. This is also normal. I should also expect that the smell will be stronger. Next on the list is green poo. Green poo for baby is also very normal. It is very normal because it can be as a result of iron supplement, or maybe the baby is teething. Because usually when the baby is teething, they produce more saliva. I know you've seen the draw, like they produce more saliva because thing is disturbing them. So, and those saliva, they get to swallow them a lot. And trust me, saliva speeds up what? Digestion. So because the digestion is going fast, like I said before, because the digestion is going fast through the intestine, the food does not have time to change color. That's why I usually see those green color, not a sign of danger. But then if you feel like your baby is not looking very well, that's why you should also look at your baby. If you see like the baby is not looking very well, then you should show concern. And just to repeat myself, I already told you the reason for those green colors because of the bile, the dark greenish substance from the liver that help to digest the fats. Two more things I would like to say is that baby poo are usually very watery. So that's why sometimes it just escape the diaper from the leg to your leg, and then everything, don't scatter everywhere. But then if it is something that you see that, okay, this is too much, then you should show concern. Then secondly, sometimes you hear some sound like grrr, like brrr, like a lot of sound, but then you check the diaper, nothing. And like, is it her stomach? Is it? So my mom will be like, my first child, I was so worried. So she said until people started like, no, don't be worried, this and that. So apart from making research for myself, I have a very trained mother. So I want to tell you that it is normal. It is normal because baby usually have this immature digestive system. So but as they begin to grow, it gets stronger. So now when should you be concerned? When the baby poo is white and you just see white all the time, then you should be concerned. When it is red, you should be concerned. It is red all the time, you should be concerned. It is too watering and the baby is already taking formula, be concerned. Thank you very much for listening. I really appreciate. I hope that you share this video to mothers, to your sister, to your auntie, to everybody around you. Thank you for listening. Bye bye.